A new Tennessee law is changing the landscape of medicine in our state, and it could mean new hope for patients who've been told they've run out of options. House Bill 2246 makes Tennessee the first state in the nation to open stem cell and regenerative medicine treatments to qualified physicians across all specialties. That means your doctor, whatever their field, may now be able to offer cutting-edge therapies using your own cells or those from a healthy donor. You're watching A Better Memphis. I'm Kim Clark.
And I'm Joe Burchin. Joining us today to talk about this new legislation is Dr. Gregory Laurence, who spent a decade now working on this very issue.
Now, Dr. Laurence, Tennessee just made history, right? And can you explain in simple terms what this new law actually means for patients and the doctors that treat them as well?
This is worldwide history.
Yeah.
This is a big deal. Out of all the states in the U.S., among all the industrialized countries, Europe, parts of Asia, no one has moved into this area to tell doctors you can do this.
That's amazing.
And you can bring these new technologies to patients. No one's done it. Now, Tennessee's done it the right way. There's guardrails to make sure it's done correctly. And just imagine, you can be a person who's had inflammation somewhere in your body, maybe a damaged organ, injury or pain, and if you've run out of options from traditional surgery or meds, you now have another option that doctors will have in their toolbox.
That's amazing.
All right, so this law opens stem cell and regenerative medicine options to qualified physicians all across all specialties. Why is that significant, and what does it mean for a patient who, say, sees a cardiologist or a neurologist?
Yeah, it's a big deal. Now, I need to warn everybody out there that doctors did not learn this in medical school. We didn't learn nutrition in medical school, so we did not learn stem cells for sure.
Right.
So for 10 years or longer, I've put this into my entire practice. Everything that I do in surgery, I think about stem cells. How will they make it better for my patients? And I've discovered that they work better than I thought they would ever work. It's more complicated than I thought it would ever be, but I've gotten smarter and smarter over these years. And so what I'm going to be able to do is I'm going to be able to work with subspecialist doctors, kidney doctors, heart doctors, bone doctors, brain doctors, back doctors, and we're going to be able to put multi-specialty teams together, and we're going to be able to bring these technologies to patients, and we're going to be able to bring them soon.
And this law is very specific about where those cells can come from, a patient's own cells or from a healthy birth donor, birth mother, I think it is, explicitly prohibits the use of cells from aborted fetal tissue. Why is it so important to have those guardrails?
Well, we want this new area of medicine to be ethical. We want it to have integrity, and there's no reason to use those things that involve coercion of patients. We will use technology, and we use them every week in our practice, either from, like you said, a healthy donor mother at the time of a C-section, and there's wonderful technologies that come out of that. But then, most people have heard about bone marrow stem cells, but they didn't know that really there's other areas in the body, other tissues that even have more stem cells. It's more robust. So whether it comes from a blood draw or whether it comes from somebody's adipose where we can tease out the stem cells and use them, we've seen results that I never would have believed in medical school were possible.
Wow. Well, you have been candid that this law is going to create some confusion both for the public and many doctors with so many regenerative technologies out there. How does a patient know what questions to ask and what to watch out for?
Boy, with much privilege, there's much responsibility. Yes, there's going to be massive confusion. My doctor colleagues don't know about this. There are dozens of types of stem cells and regenerative technologies. One of the things that we've decided to do, because we want Memphis to become a tourism destination of the world, it could change Memphis. And with the logistics that we can lean in with FedEx and companies like that, it really could happen. And so what we're going to be doing is asking a philanthropist to step forward to do the most expensive procedure ever done in the country. $10 million is what we're asking for. What are we going to do with that? I'm going to put together a specialty team. We're going to use a stack of technology over a 40-day period. We're calling it the Memphis Genesis Care Protocol, and that would resonate with people of faith in Memphis. 40 days is a significant number, but we believe over that amount of time we can restructure an organ or recover an organ or support an organ, whether it's a heart, a kidney, a brain, lungs. We've already done that in Germantown, Tennessee, where I've developed some technology, but I also believe that a lot of biotech companies bring things. And when we put all those together, we're really going to be able to do something special. And the reason we need the money, the doctors will not take any of the money. This is for Memphis. We want Memphis to be the hub of international stem cell medicine for the world. I look forward to a day that there will be a terminal at the airport named after a stem cell doctor.
Wow.
Might be me, probably not. Could be Joe Birch. Could be Joe Birch.
I don't think so.
But along the confusion, we're going to use that money to help educate doctors, educate patients, and do things the right way. One of the things that's going to clear up the confusion is for 2 years I've been working on a scorecard for a person to know, okay, these are FDA not yet approved procedures.
Okay.
These are not covered by insurance companies yet. So we want to get it covered by insurance companies. We want it to be affordable, but we want people to lean into this and know whether they're the right to do it. So I've created something called the Golden Mindset Scorecard, and it's the easy way for a doctor and a patient to realize that they're doing the right thing for that patient. Secondly, and this is going to take a lot of confusion away too, is when you get a stem cell procedure done, you need to know what technology you had, because there are dozens of technologies and doctors don't know them yet. So how can we bring a common language so that your medical team can know what you got? And both of those tools are going to be on our website, SYLF.com, SYLF.com. And if they're not there yet, call my team. We want you to find the right doctor. And we're close to new patients right now. This has taken over our practice.
Wow.
And so we just want to help other doctors to be able to do it. We want to lean into them, and it's just going to be wonderful to this next 3 years in Memphis, what we're going to become here in Memphis.
It sounds incredible. Now, the law requires that any advertising for non-FDA approved stem cell therapies include a clear disclosure and encourage patients to consult their primary care doctors. First, in your experience, how big of a problem has misleading marketing been in this space?
First, I want to thank Senator Ed Jackson for how he put this together. So they put guardrails. One of the things I wish they would have done is require that the physician involved with the advertising have his name disclosed on all advertising, but we're going to be working locally for that to happen.
Okay.
Like I said, with the self-tracker, we also want to make sure patients know what questions to ask about what technology they're getting, and I think with those tools in place, we can allow for a lot of clarity, and I'm just going to be asking the Memphis community to lean into a higher level of responsibility. We need data, we need robust clinical trials. Right now, we can go ahead and start treating patients, but we really need to do this the right way.
Right.
Well, Dr. Gregory Laurence, thank you for taking the time to share this with us. This is
Brave
exciting.
new world.
This is exciting. And what you're talking about in terms of being an economic engine for our community is fascinating. And so we'll be following this carefully.
I can't wait till the self-insured companies step forward and give these to their employees before we have insurance codes. So I'm challenging FedEx and AutoZone.
Okay.
Very good,
All
sir.
right.
Well, thank you
Challenge
for being
thrown.
with us.
Thank
All right,
you.
thanks for being with us.
Thanks, guys.